Is all about laryngeal mask airway, a supraglottic airway device that facilitates oxygenation and ventilation without any intubation. Now, being supraglottic, this airway device lies above the level of vocal cords. In this video, we will try to understand the generations of LMA. We will understand how this device is inserted, when it is used, and first and foremost why LMA is being used. So let's try to understand why LMA is actually used first. So LMA is used because of ease of insertion and really very small learning curve and providing a rapid and secure airway easily. Next thing we need to note is that laryngoscopy is not required to insert an LMA, and in most cases any muscle relaxant is also not required. You may require minimal anesthesia in cases of LMA. To avoid any C-spine extension to visualize larynx, we use LMA in cases we have C-spine injury and you cannot extend the C-spine. It has also the ability to drain gastric fluid. These are the common reasons why we are actually using the LMA. The next point to note is that how LMA is being inserted. Now, to insert an LMA, you hold LMA like a pen. Okay, you hold it like a pen. Next thing you do is you insert a deflated cuff along the heart palate. Along the heart palate, you insert the cuff in midline or laterally, and the guide is the index finger. You place it above the larynx. Exact position is the proximal end lies on the epiglottis and the distal end on the upper end of the esophagus, meaning it sits in the hypopharynx, forming a seal around it. Okay, this is important to note that it lies at the epiglottis and below at the upper end of esophagus, forming a seal at the hypopharynx. This is how LMA is inserted, and we need to also know when LMA is actually used. So the first scenario is when we have any emergency. Okay, and intubation and mask ventilation is not possible. In those cases we may use LMA. The second scenario is when we have a difficult airway insertion during any cardiopulmonary resuscitation, you go for LMA. The third thing is in minor surgeries where anesthetists prefer to use the LMA, you may use it. The fourth thing is procedures that are done outside the operating room, as the radiation therapy or a diagnostic or therapeutic procedures. Nowadays in pulmonary medicine for bronchoscopy or thoracic surgeries, we are also preferring LMAs. So we till now we have understood the LMA device, that is supraglottic, how it is inserted actually, and when it is used and why it is being used. Next, we will try to understand the main exam questions that are about the first generation and the second generation devices. Okay, so the first generation device is actually really simple because it has just a tube. Let's try to understand a classic LMA, which has just a airway tube, an inflation line or the inflation pilot balloon, and a cuff. So it is really simple. So what went wrong with the first generation is it was really simple. That's the point. It had low pressure pharyngeal sealing, and this low pressure pharyngeal sealing increased the risk of aspiration of the gastric content. And also first generation device did not had any specific design, and this was the reason we went for the second generation. To remember the first generation device, you can remember the mnemonic cuff cobra. For C is the classic, U stand for unique LMA, F for the flexible LMA, and cobra is for cobra perilaryngeal airway LMA. So the first one, that is the classic LMA, we already discussed, has simply a airway tube along with a inflation pilot balloon and a cuff. Being simple, it has a risk of regurgitation of gastric content. The next one is the flexible LMA. This flexibility allows it to have no kinking while bending and can be used thereby in head and neck surgeries. The next one is unique LMA. Unique is unique in the sense that it is disposable, and this is the only difference of it from the classic LMA. It is classic LMA actually which is disposable. The next one is the Cobra PLA, that is a perilaryngeal airway. You need to know 2 points about it. The first one is its specific appearance, and it seals the airway at a greater pressure than the other LMAs. It can be used in spontaneous as well as controlled ventilation. Note, just remember the images of these LMA. These come in exam. You need to know the classic, flexible, unique, and cobra, cuff, cobra. Okay, now moving into the second generation, which was devised because of the drawbacks of the first generation. This came out to be safe because it had high pressure pharyngeal sealing that decreased the risk of aspiration. Also, we added a drainage tube. You see in a MCQ extra drainage tube. It is actually most of the cases second generation, not always. Okay, so it will have a high pressure sealing as well as a drainage tube. So let's see into the devices. The first one is the ProSeal LMA, and the next one is the Supreme LMA. We are discussing them together because in most of the cases they are actually same. The difference is ProSeal LMA has a silicon cuff and a Supreme LMA has a PVC cuff. Now the difference is that the Supreme LMA being have a PVC cuff makes it disposable, whereas ProSeal LMA is not disposable. It is made up of silicon. Okay, otherwise you can say that Supreme LMA is actually a disposable version of the ProSeal. Other things are same about both. So ProSeal LMA, you will see, and this is the pilot balloon port that you are actually seeing also in the first generation. You will see an extra gastric tube. This is the difference from the other first generation devices you will see. So you will actually have two drains here, okay, airway and a gastric tube here, and you also note that it has two cuffs. The one is visible here, and these two cuffs provide a higher seal and decreases the risk of aspiration. These are important point about ProSeal. Similar things applies for the Supreme LMA, that it is a second generation airway with a gastric access and delivers new standard of patient cares. Okay, the third one and really important is the eye gel. Now it is important in the sense that it has a medical grade thermoplastic elastomer. Now this medical grade thermoplastic elastomer takes the shape of the airway. Okay, this is an important point. Also note that it is disposable, single time use, and is color coded. It has 7 sizes and these are color coded. Note it has really no learning curve and very easy to insert and is safe in child. You also need to know about sleeper, that is streamlined liner of pharyngeal airway, that is sleeper. And you need to know some basic point about our sleeper, that is its appearance, that is really different from any other. It appears like a plastic, it is total plastic uncuffed tube. Okay, that is the difference. You see the distal end is hollow boot like shape. Okay, 2-3 points you remember is that this point is the bridge. This bridge point lies over the piriform fossa, the toe lies over the epiglottis, and the heel lies over the soft palate. So note this LMA, that is sleeper, is going above up till the soft palate. Okay, so this is really a long instrument, long LMA, that is sleeper. Also this increases the risk of injury because it being totally of plastic and uncuffed. Sleeper. The next only an image based question you must remember, and a second generation device, that is AirQ. The next, and this is a high yield image, that is also known as King's laryngeal tube, or it is the just laryngeal tube. Remember this image. Okay, this is all you need to know about second generation devices. The ProSeal and Supreme LMA, you need to differentiate image of eye gel and sleeper, and remember AirQ and laryngeal tube image. Okay, for third generation device, just remember this image again, that is known as Baska mask. It provides an excellent positive pressure PPV, that is positive pressure ventilation, and has superior gastric reflux suction clearance. This is a specific appearance of Baska mask, that is a third generation LMA. Now the last thing is that when in what scenarios you will not use this LMA, okay, because it is really easy to use, but there are scenarios where you can't use LMA. And the first one is when there is really small aperture of mouth with a mouth opening of less than 1.5 centimeter. This is a man who cannot have LMA insertion ever. This man also has a oropharyngeal or pharyngeal abscess or mass. In this scenario again you cannot use the LMA. Eating a lot, has a full stomach, a pregnant lady, and third, hiatal hernia, where a part of the GEG goes up, that is hiatal hernia. These three conditions are specific in one thing. They have a common thing, that is these three conditions have increased risk of aspiration, and because of increased risk of aspiration we avoid use of LMA in a patient having full stomach, a pregnant lady, or having a hiatal hernia. Again, one more thing, in a patient who is obese, in obese patients you see in this image FRC is reduced, and also we have a low pulmonary compliance. Again, in these patients you cannot use a LMA device. Okay, these were some bits about LMA again. So summarizing one more thing for our exam is that again we need to classify this. This is a classic LMA. This is first generation device. You will identify it by a simple tube and a pilot balloon and a cuff. The next device, that is LMA ProSeal, is the second generation device we know, and LMA Supreme is the second generation device. We already discussed, we differentiated by one point, that is LMA Supreme is the LMA ProSeal which is disposable, okay, and it is completely disposable, made up of PVC, where it is made up of silicon. These were some important points. These images, please see them again. These are important points about LMA. Hope you liked it. Thanks for watching.